All right. So I'm Franklin King. I'm a psychiatrist. My talk is called Psychedelic Projections, and it's an actual talk. So I think we can make it through. Um, Projections, broadly stated in psychiatry and psychology, refer to unconscious feelings, emotions, thoughts that are attributed to other people, just by way of background to this talk called Psychedelic Projections. LSD is a psychedelic drug that occasionally causes psychotic behavior in people who have not taken it. This famous quip by Timothy Leary, who remains 50 years later Harvard's most notorious psychologist, reveals a prescience that was probably deeper than Leary knew. In this statement, Leary only captured half the truth, missing an opportunity to observe the striking ability of psychedelics to cause people to project all sorts of values and feelings onto them, not just negative, but also positive. It is this tendency, the way the word psychedelic in quotation marks means different things to different people, that has largely been ignored in the contemporary discourse surrounding the medicalization of psychedelics. Exploring these hidden meanings might explain the often dramatic and highly charged debates concerning psychedelics currently playing out across the media, academia, and Twitter sphere, or X sphere. Psychedelics are primarily in the zeitgeist, ostensibly at least, due to their potential use as tools to alleviate psychiatric suffering. But how did it come to be that after 3 decades of relentless propaganda about psychedelics being drugs that could cause permanent mental illness, these are now suddenly being embraced as potential medicines for some of the most vulnerable psychiatric patients? The answer may lie in the overall clinical landscape. It seems no coincidence that after many years of obstruction by the federal government, clinical research on psychedelics only began to generate widespread institutional interest in the late 2010s. The return of psychedelics to psychiatric research bears a remarkable correlation with what the New York Times described way back in a 2013 op-ed as a dry pipeline for psychiatric drugs, a pipeline that in the ensuing 11 years has failed to generate any truly novel or effective psychopharmacological agents. Data show that while favorable attitudes among psychiatrists towards psychedelics are rapidly increasing, this shift has and continues to be disproportionately composed of younger psychiatrists, precisely those who came of professional age at a time when few other new treatments were on the horizon. Older psychiatrists who lived through a golden era of psychopharmacology when tricyclic antidepressants, benzodiazepines, atypical antipsychotics, and SSRIs first hit the market tend to hold more reserved opinions. Thus, clinical attitudes towards psychedelics may be more reflective of the overall context in which contemporary psychedelic research occurs, that is, a perceived lack of promise in drug development more generally, than to the clinical benefits of psychedelics per se. However, it is clear that for many, if not most psychedelic researchers, psychedelics represent something more than just another medical treatment. Although that something more is often unexpressed and undefined, it may hold the key to better understanding the truth in Dr. Leary's famous quip, as well as what Michael Pollan has called the irrational exuberance that surrounds, on the other side, overly optimistic takes on psychedelics. Defining this something more might lead to clarity on why the debates within the psychedelic space are so highly charged, as well as to lead to more grounded perspectives on the real risks and benefits for the medical applications. I want to interrogate what it means to depict psychedelics as medical treatments. Current debates concern whether psychedelics are mere biological treatments, that is, drugs, that need only be administered with a so-called monitor or in the presence of psychological support, as opposed to being just one component of a paradigmatically different treatment called psychedelic-assisted therapy. Furthermore, we debate whether psychedelic-assisted therapy is more than what it sounds like. Is it really just drug-assisted psychotherapy? Or beyond just a new therapeutic modality, does it represent a clinical philosophical worldview that stands in contrast to the prevailing biomedical paradigm? An orientation not only toward the value of psychotherapy in contrast to drug treatments, but also to the explicit value of the patient's own subjective experience and agency and the interrelational processes between therapist, patient, environment, and sociocultural milieu in which the therapy occurs. And if so, then this begs the question, Is this a therapeutic orientation that requires psychedelics in the first place? Many of you are likely familiar with a commentary published last summer in the American Journal of Psychiatry, authored by the leaders of a company pursuing FDA approval of psilocybin with, as they call it, psychological support. In this piece titled, "Must Psilocybin Always Assist Psychotherapy?" the authors question whether the therapy and psychedelic-assisted therapy can even be called therapy at all. In it, the authors argue that the effects of psychedelics are primarily due to biological processes, and therefore conclude that the current model of psychedelic-assisted therapy, as currently named and practiced, is inappropriate. The paper ignited considerable controversy, leading the journal to publish an unprecedented 6 letters to the editor in January of this year, all of which argued strenuously against the author's logic. Disclosure, Eduardo Schemberg and I co-authored one of these letters. Clearly, strong feelings were aroused. But why the strong feelings? Most of the responses to the initial commentary argued that discounting the psychotherapeutic framework would lead at best to ineffective treatments and more dangerously could expose patients to potential harms of poorly assisted psychedelic psychotherapy. However, personal conversations as well as published qualitative reports on psychedelic researchers' opinions revealed deeper tensions over different visions of psychiatry, tensions which are neither new nor unique to the psychedelic space. Psychiatry has never been free of controversy. In Madness and Civilization, Foucault examined how institutional psychiatry acts to transmit and reinforce power roles within society. R.D. Laing wrote existentialist critiques of his own profession that at times have been called anti-psychiatry. More recently, however, with the rise of biological psychiatry, that is, models of mental illness based on the brain, and an approach to care that increasingly turned away from therapy and increasingly relied on medications, a somewhat different critique has emerged where the field's abrupt biological turn in the 1970s has been criticized for embracing a reductive conception of mental suffering. This in turn has led, so the critique goes, to an approach to psychiatric care that favors shorter visits, prescription of medications, and a reduction in focus on critical contextual and relational elements alongside the overall sociocultural and environmental context in which a patient's suffering occurs. I believe that it is a lament over this change and a desire for alternative approaches to psychiatric care that are behind much of the enthusiasm and strong positive feelings about psychedelics within medicine. Most people I encounter who are drawn to psychedelics from within the field are drawn to them because they represent an opportunity to move away from perceived biological reductionism and move toward a more holistic and contextually appreciative approach to patient care. It is curious to consider that these factors are quite similar to concepts of set and setting, so widely viewed as critical for a healing psychedelic experience. That psychiatry is perceived by many to have turned its back on set and setting as a general concept, irrespective of psychedelics, perhaps explains why clinicians most interested in psychedelic-assisted therapy tend to be those most disillusioned by bioreductionism in psychiatry. The psychedelic researcher Tassin Noorani observed in his 2021 paper, Containment Matters, that psychedelics, quote, inspire a secondary hope that the safe and efficacious containers in emerging paradigms of psychedelic medicine will offer templates for a much more contextually sensitive psychiatry in general. This hope contains a redemptive promise to rectify psychiatry's over-embrace of acontextual drug-based remedies since the mid-20th century neurochemical turn, end quote. Perhaps Noorani has in fact identified the more primary fundamental aspiration underlying the enthusiasm for psychedelics in the lab and in the clinic. So is it just competing visions of psychiatry that are driving all the drama in psychedelics today? Or is this just the tip of the iceberg? Critiques of scientific reductionism transcend debates in psychiatry or even medicine, touching upon epistemological divides simmering at times to a boil since the rise of modernity. In the 1920s, George Lukács, one of the founders of Western Marxism, was among the first to examine how forms of knowledge, including scientific rationality, reflect and reinforce economic inequities and power structures. Theodor Adorno wrote that Enlightenment philosophy unwittingly produced a disenchanted view of the world, denigrating as unreal anything not objectively reducible to numbers. More recently, scholars in critical race theory, decolonial theory, and epistemic injustice have explored ways that existing structures of knowledge and knowledge acquisition perpetuate colonial systems supporting a white and Western epistemic hegemony. The concept of the cognitive empire highlights how the global North, representing a mere 25% of the world's population, dominates the acquisition, production, and dissemination of global knowledge. While this empire promotes a worldview rooted in global North-derived biological materialism, the use of psychedelics, of course, arose in the global South, as we have heard several times today. Appreciating that psychedelic use arose in such non-Western frameworks highlights how the history of criminalization of psychedelic substances arose in systems aimed at subjugating these same cultures, whose very knowledge is now being used to advance what has been repackaged as a Western medical invention. One of the first principles of psychedelic-assisted therapy is honoring the person's direct, subjective experience and conceptualizing psychedelic therapy as an experiential process. Unlike the Western medical model, which is largely prescriptive, the role of the therapist in psychedelic therapy is neither to direct nor interpret a patient's experience, but rather to hold space and supportively allow the patient to have their own experience and engage with their own meaning-making process. It is this underpinning philosophy that is so important to psychedelic therapy, not the psychedelic drug itself. Confusion between the two may be leading to blurred arguments against, for example, the potential utility of the non-psychotropic psychoplastogens, those currently mythical serotonin 2A receptor agonists that are highly sought after in contemporary pharmaceutical research that would do away with the pesky necessity of having to deal with the psychedelic experience once and for all, by, hypothetically at least, producing clinical benefits without a psychedelic experience. Many scoff at this concept, but what if the psychedelic experience wasn't actually necessary for drug efficacy? By what logic would people argue then that the trip still matters? Arguments that the psychedelic experience is crucial for psychedelic-derived benefits are vitiated when these arguments are framed in terms of clinical efficacy alone. It would be more compelling, but far more disruptive, to make the argument beneath the argument that there is intrinsic worth of the psychedelic state itself. Mindfulness and the meditation practices aimed at cultivating it have steadily entered mental health care over the last 2 decades and offer a useful parallel to psychedelics as they have faced similar challenges. The concept of mindfulness derives primarily from non-Western meditation practices that are themselves components of broader spiritual traditions that reflect specific worldviews. Like psychedelics, these practices have faced challenges in their transformation into medical treatments, often applied in settings where they are stripped of what many argue are essential socio-spiritual contexts, contexts from which these practices are inseparable, in an effort to make them and their benefits more generalizable and quantifiable. In addition, many meditation traditions, Western and non-Western alike, emphasize the centrality of direct personal experience as well as ongoing personal practice, but practice for its own sake. In other words, to meditate with the intention of reaching a specific outcome, such as reducing depression, is to miss the essence of meditation itself. The benefits, such as calm or reduced anxiety, are byproducts that arise naturally when one surrenders to the practice without seeking them. Critiques of so-called McMindfulness programs that transform practices for the exploration of consciousness and the achievement of bliss into an intervention aimed at reducing scores on clinical rating scales reveal striking parallels with contemporary psychedelic debates. Many might argue that, much like meditation, the benefits of psychedelics are more likely to be obtained in a context that recognizes the psychedelic state as valuable in its own right. Perhaps we are, in fact, introducing more risk by offering psychedelic-assisted therapies as treatments. Perhaps the focus on some specific psychiatric benefit is irreconcilably anathema to the principles of trust, letting go, and being open to whatever the experience may bring. Perhaps it is worth considering if psychedelic programs might paradoxically produce more mental health benefits and less adverse effects if they were focused on non-specific benefits of the psychedelic state, rather than in dialing down psychopathological scores. This returns once again to a tension that Canadian author Marianne Apostolides has called the psychedelic divide, a tension between those viewing psychedelics as biomedical tools to treat mental illness via neurochemical modulation versus those who view psychedelics as tools for personal and social transformation and emphasize interconnectedness and well-being. The crux of this issue lies in the perceived value or lack thereof in the psychedelic state itself. There is a dominant cultural bias against non-ordinary states of being and consciousness. Ours is a culture that strongly values ordinary waking conscious states and pathologizes non-ordinary states, drug-induced or not. Dreams are interesting, but they do not confer useful knowledge. People don't seek insights from trance states. Drugs might make you feel good, but the actual drug experience teaches you nothing. At best, these are appreciated as interesting, curious, but likely pathological brain phenomena. The Scottish philosopher Sarah Ritchie suggests that this is due to, quote, an insidious and totalizing physicalism that reduces extraordinary conscious experiences to mere neurological events, end quote. That is, extraordinary states of consciousness which may have such profound effects on the experiencer are presumed to lack any true epistemic value. This is a deep yet hidden reason why the pressure to devalue or obviate the need for a psychedelic experience, a non-ordinary state, is so immense. Despite a common feature of the psychedelic experience being a noetic quality, the experience of intuitively felt inner knowledge that is realer than real, the focus in clinical trials replicates the bias against the experience itself because it is concerned only with a specific outcome, that is, the change in a number on a rating scale, rather than with understanding the person's actual experience, what it was like, how it helped them, how it felt. This is also reflected in the clinical world. I have had patients tell me about ketamine clinics where they have been essentially told that the drug works, but that the unfortunate hallucinogenic side effects must simply be endured in order for the medical benefit to occur. Despite the fact that study participant after study participant describes how important the psychedelic experience itself was, we continue to hear debates from experts as to whether the experience is in fact actually valuable. Perhaps the more important question is, valuable for what? In a more measured contrast to Leary, Stanislav Grof, the famed psychedelic psychiatrist, once stated that LSD is an unspecific amplifier of unconscious processes. Perhaps this is as true on an individual level as it is with the collective. While psychedelics may catalyze certain shifts in psychiatry, they alone do not have the power to fundamentally transform it into a field that deeply values subjective experience, displaces biological reductionism, or embraces relational and contextually sensitive approaches to care. Achieving these shifts requires intentional, sustained systemic change. While psychedelics amplify worldviews and aspirations projected onto them, they do not inherently fulfill the transformative visions many attach to them. Much like spiritual bypassing, even those who advocate for dismantling power structures in medicine or envision broader goals like decoloniality, epistemic diversity, and social transformation may not fully grasp or even desire the profound changes these concepts truly entail. If we are to avoid psychedelic utopianism and correctly acknowledge psychedelics as amplifiers of ideals rather than as architects of social change, these broader agendas must be addressed in their own right, rather than cloaked in the putative promise of the psychedelic experience. Articulating these values explicitly rather than hiding behind psychedelics to achieve them would also place psychedelic researchers into broader academic conversations about anti-imperialism, post-coloniality, critical psychiatry, and neoliberalism. Such powerful agendas could provide guidance toward a broader understanding of how psychedelics might be integrated and to what ends in medicine, policy, and culture at large. Thank you.